Hello, Dr. Vikki Petersen here. I want to talk to you today about vitamin D. We've spoken about vitamin D in the past, but I don't think you can really talk about it too much considering how important it is and unfortunately how many people we run into who have low vitamin D. Now we know it's very important for bone health and heart health and for your immune system. It's really important for everything, but there are two key areas that I wanted to talk about today. To backtrack for just a moment, vitamin D is actually a hormone, not a vitamin, even though we call it a vitamin. And when you have sunlight and cholesterol, then you make vitamin D3, and it has to then turn into the active form of vitamin D called calciferol, and that happens in the liver and the kidneys. So there's a little process that it has to go through in order to be active and utilizable, which is important to know. However, what's really important, and we talk about this a lot, is inflammation. And we've discussed the fact that inflammation is really at the root cause of most, if not all, of our degenerative diseases. And vitamin D, when you have a good amount of it, actually controls inflammation. So anything that helps inflammation we need to know about. Anything that adds more fire to the flame we need to know about, because this inflammation is a very key modulator of which way we're going in our health. Are we going toward disease or are we going toward better health? So vitamin D levels need to be good to prevent inflammation. So that's a real good take-home message. But the second take-home message is that vitamin D has been found to be linked to the tight junctions in the gut. So we've talked about zonulin, a protein that kind of is the gate, allows the gates of the intestine to open and close, and how if you have too much of this, you have gates that are wide open, and that is a leaky gut. And with a leaky gut, you get all sorts of different diseases, including autoimmune disease. So we know a leaky gut is bad, but did you know that vitamin D is key in that gatekeeper system in your small intestine? So it absolutely is. So another reason, another very, very important reason to have adequate amounts of vitamin D. So you should get your vitamin D levels checked. It's usually a part of a basic blood test, but you can just go and get your D levels checked, even if you recently had a physical. For some reason it wasn't on there. It's not a terribly expensive test to do, and I would very much encourage you to find out what your base level is. You should shoot for about 50 nanograms per milliliter, usually the NG and then /M capital L is what nanograms per milliliter looks like, and that's typically the designation that you'll see on the test, but 50 is the number that you're trying to go for. And if it's lower than that, what we do here at the clinic is approximately 2,000 international units per every 10 we want to raise the level. So if somebody's at 20, obviously we want to raise it 40, and so we do 2,000 per every 10. And 20 is very, very low, although talking about disease and inflammation, there was an interesting study, I digress for just a moment, but it is quite interesting, associated with breast cancer and vitamin D levels, showing women with very low vitamin D levels at a 6-fold increased risk for breast cancer. And it's interesting because the vitamin D has receptors all over the human body, but the breast, the prostate, skin, brain, heart, bone, these receptors are everywhere. So certainly it's not a hard thing. Here at the clinic we use a liquid vitamin D3. It's really easy. It's in a base of olive oil, so it tastes just like a drop of olive oil. So very easy to do. And that it's a fat-soluble vitamin, so you want to make sure that it's in kind of an oil base, and the liquid is super easy, and it's just for us just a few drops is how we do it, so you're not even swallowing a capsule or a gel cap. But it's not hard, but really, really important to make sure your D levels are healthy. So take heed. go get your D levels checked. If you have any question, now a whole nother discussion is if your D levels aren't going up because you're not absorbing fats. That's a discussion for another time, but at least let's start and see what your D levels are and start taking some good D and see how we get from there. And then if you're having trouble raising the D levels, then we look a little bit deeper into your ability to absorb fat and nutrients on the whole. It's interesting how D will make your intestines healthy, and then if you don't have it, you're not going to absorb it, so you're getting a little bit of a catch-22, but nothing that we can't circumnavigate, or circumvent was a better word. All right, so until next time, I wish you very good health, and I hope this was informative.